minor hockey is back.
You guys ready?
Yep.
All right, you gonna play hard?
The Greater Toronto Hockey League hit the ice this month for the first time since December after Ontario eased pandemic restrictions.
Cameron's out. Look, there he is. Yay, you can wave now. Number 4.
Capacity is limited. The arena is half empty.
Oh!
But to Danielle Cameron, it's half full.
Yay!
The hockey mom cheering on 7-year-old Cameron, her oldest of 3 children, in one of 3 games he and his sister are playing this Saturday.
That's hard work.
There we go, guys.
Danielle's husband, Aaron, is better known as Coach.
During the pandemic, any chance at some normalcy is welcoming, and for the kids especially. I mean, they've lost so much through the pandemic and, doubly with me going through what I'm going through with cancer. Yay!
For Danielle, cheering from the stands is a high-risk activity. In December 2019, she was diagnosed with inflammatory breast cancer, a rare, particularly deadly disease.
Penelope, come see Mama.
She now requires in-hospital treatment every 3 weeks, but for now at least, her stage 4 cancer is stable.
People like to think of stage 4 as your cancer sleeping. Like, that's what I tell my kids. They ask me all the time, "Mommy, is your cancer still there?" And I'll say, "Well, yes, but it's sleeping right now."
She remains immunocompromised and highly vulnerable to COVID-19. During the pandemic, she stayed mostly indoors. The family canceled a planned vacation to the Dominican Republic.
And where's Daddy? Can you see him? Where is he?
But after 2 years, Danielle is done hiding at home.
I'm tired of waiting. I don't know how much time I have on this earth, and hopefully it's many, many years to come. But if it's not, I don't want to wait to go and see my friends or to make memories with my children. And every time they tell me to get a booster, I'll get a booster. And we're going to live our lives, but safely.
Learning to live with COVID-19 has become something of a controversial catchphrase used by politicians.
We have to learn to live with it.
Learn to live with the virus.
Learning to live with COVID.
Business owners.
Life has to go on at this point.
And protesters. But now, even frontline staff here in Danielle's hospital are talking about the need to find a new way forward.
Learning to live with it is what we, as a healthcare community, need to be prepared to do.
Dr. Leon Rivlin is the medical director and chief of the emergency department at Toronto's Humber River Hospital.
Who's your surgeon?
He and his team measure the pandemic both by the numbers and by who comes through that door every day. On this morning, there's a patient with a gunshot wound, another from a car accident, and this woman with COVID-19. Struggling to breathe.
Your heart rate is still faster than I want it to be.
Her doctor, Thasleen Ninji, is the physician in charge of the hospital's pandemic response.
She's a middle-aged woman with no medical history, otherwise healthy. Here her risk factor really was that she was not vaccinated.
But these days, their most pressing concern isn't COVID-19 per se.
You have 14 patients?
But rather the fallout
Hey
from 2 years of pandemic lockdowns,
guys.
including a sharp spike in the number of patients suffering mental and emotional distress.
Don't give me food.
We want to help you.
Show your face.
Back up.
This patient was brought to emergency by police,
Okay, what's the story?
arrested for threatening behavior outside a nearby shopping plaza.
Opens up his shirt, I guess, and says, "I've got a bomb, I'm gonna blow this place up."
Dr. Rivlin says the man has a history of substance abuse and psychosis.
Feel a little bit better.
Smoke a cigarette.
I get it.
I do not like human beings. Only animals.
The patient is eventually given medication and transferred to the hospital's mental health department.
The volume of the number of cases that are presenting with this level of agitation has increased substantially.
Moments later, another man is admitted with a history of depression and substance abuse.
Hey there, I'm Dr. Rivlin.
Police say he threatened to kill his father.
He just don't like me. He just hates me.
The pandemic creates this general sense of anxiety. Then when you add pre-existing disease, whether it's psychosis or depression, then it only amplifies it. Have you ever injured your dad? Have you ever hurt him in the past?
Never.
Okay, so that's what we're seeing a lot of here. We're seeing new cases and we're seeing recurrence of old cases.
What's driving this, do you think? Because we know it's sort of lockdown related, I assume, right?
Yes.
Andrew Cabaluna is a nurse who specializes in mental health and addictions. He says the pandemic's fifth wave has been the worst.
More cases of depression, more anxiety, more alcohol use, more addiction problems. So it's just been severe all around.
And more patients arriving in the ER with advanced illness who were delayed in receiving treatment because their family doctor's office is closed.
Access to care is definitely limited when your doctor's offices are less available to see you. The pain that you have today that you came in with is not related to your heart from what I could see. I think it's shoulder pain. We decrease the disease burden of COVID in the community, but we increase the disease burden of other regular diseases which aren't managed.
The main goal of the pandemic restrictions, he notes, is to reduce the burden on hospitals and intensive care units in particular. But in this ICU, the COVID-19 caseload is now manageable, according to critical care specialist Dr. Jamie Spiegelman.
We're really only seeing critical illness in two types of patients, them being the unvaccinated patients and the immunocompromised patients.
Data from the UK suggests the chances of a fully vaccinated person dying from Omicron are now comparable to the seasonal flu, though COVID-19 remains far more transmissible. But what if we see a new variant, another wave, and hospitalizations rise once again?
COVID is always going to be there. This year we had Omicron, last year we had Delta. What is it going to be next year and how are we going to respond to it? I'm just going to give this to the nurse and then we'll carry on. We need to have a broader strategic plan that's a bit more than the reactive plan that we currently have.
The harm caused by 2 years of pandemic restrictions is plain to see, but the challenge facing public health moving forward is how to avoid another lockdown while also protecting the most vulnerable. In other words, what does learning to live with COVID-19 look like to those who can die from it? Rutman Kalbul Bubu Singh has barely left her apartment in 2 years.
I only go out when I need to come to the hospitals, you know.
She has stage 4 breast cancer, which has spread to her lungs. Rutman is fully vaccinated against COVID-19. But an infection would still be dangerous, according to her oncologist, Dr. Gautam Sudan.
I think with any cancer patient who's on chemotherapy, their immune system is not strong enough to tolerate COVID.
He says the fifth wave has witnessed an explosion of cancer patients with Omicron, which causes further complications and delays for their treatment.
How are you? And I've had a few patients who have passed away from COVID who were quite healthy and doing well on treatment.
And for Dr. Sudan, that risk
Hi, Mom.
hits close to home.
Your hair was really short then. It was
very short, very short.
In 2017, his mother was diagnosed with cancer. They live in the same house, and when the pandemic hit, they kept their distance.
I stayed 1.5 years inside the house. It was difficult. It's like I could not go anywhere.
You asked for tea, it's going to take a while.
Today, she's fully vaccinated against COVID-19 and cancer-free, though still receiving chemotherapy, which weakens her immune system.
I want him to get married soon. Now COVID is over, he should be.
She says she'll continue wearing a mask and avoiding crowds indefinitely. She's planning to skip a family wedding next month.
I do go out now, but I have to be very careful, not like before. And I'm scared I don't want to end up in the hospital. That's what scares me. If I end up in the hospital, I won't be coming back.
We should go back to Greece for sure.
We will go. For sure we're good to go.
Still, both she and her son support removing pandemic restrictions, so long as our hospitals can cope.
The new reality is that COVID is here to stay. I want restrictions to, cut down. I want there to be more normalcy, but it's proportional to our ICU capacity. If we don't have beds to treat critical ill patients, you can't take the restrictions down because then we have to choose between who gets CPR and intubated and who doesn't. And that really is critical care that we need to conserve.
How are you feeling?
I'm feeling okay.
I'm going to have them take the tube out, okay? Because I don't think we need it. Just be mindful of all the people who are not as healthy as you. And you don't know who is immunocompromised and who not. And so do your part, get vaccinated.
Hanging on the wall in his office, this card that says, "Thank you for helping my mummy."
All right, was that fun, Penelope? We have fun hockey game?
Given to Dr. Sudan by Cameron and his sister Sierra. Last Christmas, the hockey mom and her children caught COVID-19.
There we go. Good job. You guys did a great job today.
Danielle says it was scary.
It was awful, but we survived. We took precautions. We did all the things we were told we were supposed to do, and we got over it, and hopefully we never have to get it again.
Say bye. Good job.
And the family vacation to the Dominican Republic they had to cancel a couple of years ago, they've just rebooked for next month.
It's been 2 years of being on edge and not knowing what to expect and being scared and fear-mongering. People need to just enjoy their lives. Like, life is short. Pandemic or no pandemic, we still have to make memories and enjoy our life. We just have to be smart about it and be safe.